Good evening. Happy New Year, everyone, and thank you so much for joining us tonight. Before we get started, I'd like to read this brief disclaimer that you see on your screen. And that disclaimer is this. The Pharmacist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And with that being said, I would like to thank you once again for joining us tonight, and Happy New Year. Welcome to 2021. My name is Craig Orpello, and I will be your host tonight for this great program. And as we mentioned, what is the Pharmacist Virtual Learning Experience? It's an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. The Pharmacist program takes place every Monday night at 7 p.m. Eastern Standard Time. And tonight we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. How is it interactive? Well, that's where you come in. You can join us via either Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format, either in the chat or in the Q&A section of Zoom. So as always, we are joined by various amazing HCPs each week from across the nation to provide you with a real world experience, just as if you were sitting across the table from them in the clinic tonight. And tonight we are joined by Wanda Hofgesang. I would like to say thank you so much for your time and interest, everyone, for joining us tonight. Thank you, Wanda. And I would now like to turn it over to you. Take it away, Wanda.
Hi, good evening, Craig, and good evening, everybody. My name is Wanda Hofgesang, and as Craig said, I am a registered nurse with over 25 years experience in the reproductive medicine and fertility field. I work here in northern New Jersey, so welcome to everybody. The Mandel's Clinical Pharmacist program, we are going to review 3 medications tonight, and we will also have live Q&A session to follow each of those videos. We would hope that you are able to ask any question that you want to present to us, but do keep in mind we want to keep it to general product usage. Anything that we find might be more specific, that we would always direct you back to your center, your clinic, your nurse, and your physician team, because they are the ones that are absolutely going to guide you with anything specific for your cycle. Also, what I wanted to say is that when you do receive your medications, I think what you want to know, the goal of tonight is to really help you feel that you can be a pro at your medication technique, administration, and possibly mixing of some of the medications. So one of the things that I do find that I like to mention is that all of these videos will be on a video library at the My Mandel's Pharmacist website. So it's real important that you know that if there's a medication that you don't hear tonight and you want to see what other videos there are, by all means, I would encourage you to feel free to review these videos again, or also any of the other videos that we have on there. So those are there for you at any time. And I think sometimes with fertility patients, sometimes the more you see it, the more it sort of sticks. So I would encourage you to think about that with the videos and not feel like you have to just see it once. Absolutely go and review it again. That certainly can help you a lot. One thing I would suggest also before we get started is when you receive your package from the pharmacy, by all means, open it up. Any package that comes to you, sometimes it may say contents need to be refrigerated, but what you'll find is some things may have shifted around in the box, and you just want to take a look and see that everything that was packed, because you will get a packing slip and it might itemize each product and tell you how many quantities of that product you may get. I think it's a real good idea to just open up, review that package, and get everything somewhat organized for yourself. I always think of it as like with like. So you might get and receive more than one of a particular item, and you can organize your cycle before you even get started. I know you may not know what those medications are for yet, but that's a real good way to feel better prepared for once you do get to the point of starting each of the individual medications. With the understanding that I think the biggest thing I always say that helps put patients at ease is I know you might see different products there, but understand that each product will always be guiding you as the practitioners and the nurse and doctor team with what medication you're taking and when you're taking it, et cetera. So don't ever feel overwhelmed that there's so many different products, because we will break them down one by one for you. And this is another way of doing that, taking a quick look at 3 of the products. So some of you might have a product called Menopure. And I'll just show you a little box that I have here tonight that can look like that product when you get it. The Menipure product you're going to see through this video is one of the medications that you will be using to help recruit and stimulate the ovaries to develop multiple eggs, which is part of a IVF cycle, or it can even be part of an intrauterine insemination cycle if you're doing that as well. So I think without further ado, what we'll have Craig do is bring up that video so we can watch the mixing and the administration technique, and then we'll be right back here with you to go through any questions that you might have regarding that product. This video is to help you with the mixing and administration of your Menopure injection. Menopure will come to you from the pharmacy in a box, a couple different boxes. They may be a little bigger than this, but this is right now what the box looks like, just in case you're wondering what it looks like and you have it at home. So you want to get that box from your safe place. It does not need to be refrigerated, so you may have this just in a cabinet, which is great. That's fine. If it's in the fridge, it's not wrong either, but it doesn't need to be in the refrigerator, just so that you know. The supplies that you'll need from, oh, nope, I'm going to rewind that before I jump ahead of myself, just to let you know what Menopure is. Menopure contains the hormones of FSH and LH, and both of those hormones work in harmony with our body, again, to help with recruitment and development of multiple follicles, which turn into multiple eggs for possibly insemination or for IVF retrieval. So the Menopure is FSH and a little bit of LH. And we have both of these hormones in our bodies naturally. And when we're administering these into our bodies via an injection, it's putting a little bit more into our system to help us recruit several eggs and mature eggs, which we don't normally have several mature eggs during our natural cycles. So that's really just that's the goal of it, just so you're wondering, why am I taking this? And that's always important to know the why. I think it helps. It helps you to understand. The other part of Menopure is, where do I inject it? Menopure is injected into either the lower belly, lower abdomen, or the upper top, upside outer thighs. That's routinely where we have our patients doing that injection for the fertility clinic I work with. And I think most often that's where most everybody is as well. So the injection goes in the lower belly and or the upper outer thigh, which is a subcutaneous injection. So those injections, you have an option of either self-injecting or someone gives you the injection. And that option, again, is yours. It's not one that it should be your individual choice to figure that out. We want you to feel comfortable with administering this medication. So if you are able to administer your own medicines, great. If they concern you to do that and you want to enlist the help of a significant other, then that's fine too. Do whatever makes your fertility cycle journey the most comfortable for you. So with regards to Menopure, where the supplies that you will need for that is going to be, you will need vials of Menopure that contain a powder or a tablet or a wafer. You know, everybody refers to that a little differently, even amongst nurses, but just so that you know, you will have little vials that'll have a powder or a tablet, and that will be what's in this box that you have of your Menopure. And you will also need to have a Q-cap, which is going to be supplied with you as well. Pardon me for having that upside down, Q-cap. So you need one of those for this medication. You also will need a 3 cc syringe. If it has a needle on it that is long, then you are going to remove the long needle. Just depends what you might get from the pharmacy. They may send you a syringe without any needle in the package, and that's great. That's what you need, because this is a 3 ml 3 cc syringe. But if it has a needle attached that's very long in length, remove that needle and discard it in your sharps container, because you do not need that long needle for this. Remember, I said this is a subcutaneous injection, which anytime you hear that buzzword or a belly or a thigh shot, that means that it's a tiny injection needle that you will be using to inject with into your body. And then lastly, what you'll need is a 1/2-inch needle. The pharmacy might send you either a 27 gauge or a 30 gauge. Just so you know what those 27G and 30G mean, the higher the number just means the thinner the needle. So the idea here is, oftentimes for subcutaneous injections, most commonly it'll be a 1/2-inch needle, and a 27-inch gauge, 27 gauge. And usually that has a gray outer little labeling system on it when you get it. Once in a while, the pharmacy might send you a 30 gauge, and that's fine to use too. So there's flexibility with some stuff, and where there is, we want you to know it's okay. But if you're ever confused or you ever have a question, obviously your nurses at your centers are always there to help answer any of those questions that you might have about your Menopure supplies. So once you get your supplies, our next thing is to, again, mixing and administering a medication is not a sterile technique, but it's a clean technique. So it's a good idea to wash those hands, use a little hand sanitizer if you're not near a sink. I'll just use the hand sanitizer for showing you to make sure that you do know that it's always good to clean those hands. And when you have everything set up, then you're ready to go. So the first thing that we would do with our Menipure is we would have to know our dosage. Your dosage that you might get from the nurses, they may refer to it as you're going to mix 1 powder or 2 powders or 3 powders. We just find sometimes it's easier for patients to understand that, since the 2 types of vials you'll have are powder and or water. So what you want to know is that she will tell you how many powders, but she may also give you a number. With Menipure, each powdered vial is equivalent to 75 units. So if you're a patient that's taking a 75 unit dose, you're mixing 1 powder. If you're a patient that's taking a dosage of 150, you're mixing 2 powders. I think the other thing I've always gotten asked about that, is it 2 shots? Nope, it's not 2 shots. It is simply 1 injection, but the strength of that shot is 2 powders. So that's what's important just to know right off the bat. Don't worry or get concerned or panic that you have 2 shots because you're doing 2 vials. It's 1 injection of Menipure, but your dosage could be a little less or a little more. And what determines that is your doctor at your clinic, based on your history, your diagnosis, and your plan, your age. All of these factors go into effect in coming up with a protocol of which medicines, what dosages, etc. So if my dosage, and I'm going to show both. If I were 75, 1 powder, or 150, 2 powder. So first off, what I do is I take these little plastic tabs that are on top of these vials and I remove them. Okay. Under there, it is sterile. However, like I say, the nurse in me is always wanting to clean the surface of anything that I'm sticking a needle into. So I'm going to clean the surface of these vials for us so that we get ready for our mixing. So we'll clean them, put them down. The next vial you will have is a vial of sterile sodium chloride. You take off that little cap. Once again, get a little alcohol prep pad, clean the top of that. So first thing you're going to notice is I'm only taking 1 vial of water. The ratio, how I always say it to patients, no matter how many vials, how many powders, what number Menopure you're mixing, always 1 vial of water, sterile saline, sterile water, to however many powders you need to mix. And it's always 1 shot. That's the key. So 1 shot, 1 water, but the variable is the number of powders that you need to mix for your dosage. And that dosage could periodically, potentially through your cycle, need to be changed and adjusted based upon your response to your cycle. So just know that this is a variable, but your nurses will guide you every time in telling you what you need to take and how many vials you're mixing. The next step is going to be to grab your syringe, and you're going to open up your Q-cap package, and you will twist your Q-cap onto the syringe. It threads right on there and it twists. Our next step is going to be that we're going to go into this vial of sterile water. Okay. In the vial, we're going to draw up 1 ml. There's a little pressure in that vial when it's new, and it can make it a little difficult sometimes to draw down. The pressure will push on the plunger. So a way to handle that is if whatever you're drawing out of the vial, you inject that amount of air, it'll help equalize that pressure. So draw back to the number 1, lining up the rim of the plunger just on that number 1 line. The Q-cap just gently pushes down on the top of the vial. Turn it upside down, and you'll see when I push, it's going to bubble. And then when I let go, you're going to see that it pushes down on my plunger because of that pressure. but eventually it stops because I did that little tip of adding the air. So what I want to do with this vial is I want to draw up 1 ml. So I would draw down to the number 1, filling it up with 1 ml. One thing to let you know about your Menipure is you will always have extra water when you draw up the 1 ml, because they put 2 mLs per vial of sodium chloride sterile saline. So what you want to know is if there's extra water in here, that's okay, because you're only drawing up to the 1. Once you draw up to the 1 and you have it in the syringe, just wiggle that vial off and discard it. Do not save these sodium chloride vials, not necessary. You have enough in your supply with your prescription. So that can go in regular trash. You will take your first of your powders, attach the Q cap, push down on the liquid. When that water hits that powder, it's like cotton candy hitting your mouth. It melts. So that little powder and that little wafer just dissolves. You can roll it around gently, but don't shake. You just want to reduce the bubbles. So you gently roll it around, keep the needle attached to it. Once it looks like it's all mixed, you're going to drain, drain, drain all the way down to that 1 ml. So I'm going to drain all that fluid that I just mixed in there, which is 1 ml went in, 1 ml comes out. Now this vial is empty. I do not save it. There's nothing I need it for. So I will once again toss in my regular trash. If I were doing a dose of 75 units, 1 powder, now I'm actually done. I do not need to mix anymore. I would take this Q cap off and attach my injection needle. But because I want to show you also how to mix 150, if you're doing 75, you would take the Q cap off after mixing 1 vial and we would put on the injection needle. But if we still need to mix 1 more vial because our dosage is 150, 2 powders, then we're going to cape that same syringe with that same liquid, which has one of the vials of Menopure dissolved already, and push both powders together now with that 1 ml, roll it around, let it mix, draw it back up. And here's where, when you're done with your mixing of your number of powdered vials, all you need to do is twist off the Q cap with the vial, and that can go in regular trash because no blood has come in contact with that. You will then take out your little 27 gauge 1/2-inch needle to inject. If I had any bubbles, I give a little snap to the syringe and that helps the air rise to the top. But if I don't do that step, is there anything wrong? Absolutely not. And I just want to help you right away because this is a mixing medication. Please don't panic about air. Air is more of a concern when you're in a hospital and I'm taking care of you and you have an IV going directly into a vein. Yes, air if you can, and you see a little bubble, you can always flick it. But there will be some little air bubbles you can't remove. And I don't want you to start pushing the medicine and letting it squirt and you're losing valuable drug. So the little bit of air is never going to hurt that little fatty tissue, FYI. Just know that so that you don't worry or panic if you have an air bubble there that won't move. Like I mentioned in the very start of the video, the injection area that we used for this is our lower belly or the upper outer thigh and top thigh. So all in here. And with Menopure, because you will take it more than 1 injection, you'll do approximately 7 to 10 of these injections. It's just good to know that you can move around in that belly every time you give an injection. You move it around a little bit. You could then also incorporate using the thigh and do the thigh as well. So some ladies will do just belly shots. Some ladies will stick with their thighs, or some ladies might combine both. No right or wrong, whatever works for you is fine by us as long as the medication, you have the right dose and the right area that you're injecting. With this medication, like I said, you could self-inject or somebody could give you the injection. So if somebody's giving you this shot, you could lay down. And when they're giving you this injection, the needle goes in at a 90-degree angle in your belly, a 90-degree angle in the top of the thigh, and a 90-degree angle into the side thigh. It's a 90-degree angle. If this were me right now and I'm standing and I'm giving my own injection, if you do give your own shots, which you can, then standing up, the injection 90-degree angle is just like this, the angle straight in. So what we do to get ready for that injection is we clean the area with a little alcohol, just clean that skin. Next step's going to be to pinch and have a little bit of fat. With pinching, be careful that you don't over pinch. I'm just going to show my arm here. When you pinch that fat, lift it a little bit gently. Don't squeeze and grab so tight. If you do, you might bruise, and you just don't want to have a bruise there. If you do get a bruise, some people can bruise from an injection. Don't worry. Just avoid going into the bruise when you give a new shot. It's not uncommon or unusual to bruise when you get your blood drawn or even given a little shot. Not to worry. It's just you want to avoid going into a bruised area to further cause any trauma to that area. So what we do here is we uncap our needle, gently pull it off. We're going to give that little pinch to the skin here. The needle goes in straight in. We do not need to jab. Once we put it to the skin, we're going to give a little push and it goes all the way. We let go of the fat and then we push that liquid right in. And then can do a 1, 2, 3 count, remove the needle. And then what you want to do here, guys, is if your sharps container is nearby, you don't have to recap a dirty needle. You can put it right in the sharps container and then put the cap in there as well. But I'm just going to be safe for me right now and just cap it so I don't have a dirty needle lying around since I don't have my sharps container. But you would put this into the sharps container. With Menipure, you're never reusing any of your supplies to the next shot. Every night you do a shot of Menipure, you gather new supplies and you use all of those supplies up, and then the next night, new supplies. So nothing is ever left over with a Menipure shot. One last little thing I will mention about a Menipure injection is sometimes you may feel a stinging sensation when the liquid goes in, and there's nothing that you did wrong with that. They do use sodium chloride to mix the powder to dissolve it, and sometimes that's just a little irritating to the fatty tissue because we have a lot of nerve endings there. So if you ever feel a little sting, don't panic with a little tiny injection. You've got a lot of, think of a paper cut. Even though it doesn't sometimes go very deep, a paper cut's really sensitive when you get it because of all those nerve endings in that little fatty tissue. So same with the belly. It'll be very fleeting when you feel it, but when that medicine goes in, you definitely can feel a little bit of a sting. And if some of your other medications didn't have that sensation, you might question, did I do this right? And I just want to reassure you that indeed you did mix it correctly. It's just that that's the nature of that medication sometimes when it goes into the body. So I hope this video is helpful for you, and hopefully you will get started with your Menopure and be successful with your mixing, but certainly understand, give it a little bit of time. The first night's the challenge, and then after that you'll become a pro at your mixing of your Menopure. Hi everybody, so we're back after the Menopure video. Hopefully that was very helpful to you to be able to see and watch that in mixing technique. I think sometimes this is one that we do get asked a fair amount of questions on because of the mixing. People get afraid of hearing mixing. And so sometimes what I always like to say, and I know I mentioned it several times in the video, but it is always a big reminder, is it's never going to be multiple shots of that same drug Menopure. It's always going to be one injection. So I always use my analogy of we could both get a small cup of coffee and my coffee could have 1 sugar and your coffee could have 2 sugars, but it doesn't change the volume of the one coffee. So the idea is that, you know, we both can be giving an injection of Menopure and you might be mixing 2 powders and I might be mixing 1, but it's just the dosage is really what is the key with that. So that is probably one of my bigger things that I know does come up sometimes when people have to mix multiple vials. Craig, I don't know if we have any questions for that medication from anyone.
Yes, we do. All right. So we got a bunch of great questions have already popped in. And so just a couple of things for everybody out there. Remember, if you're joining us on Zoom, you can just type the questions right into either the Q&A section or directly into the chat. Either one of them we will get to. And obviously, if you're watching on Facebook Live, feel free to just throw your questions right into the chat and we will definitely get to those. And just like this question that came out. So this question asks, what are the benefits or drawbacks of using Menopure alone versus FSH in my treatment cycle, if there are any at all?
That's a good question. And so with fertility cycles, in the part of the cycle that you are recruiting multiple eggs, generally speaking, there are different products that can help individuals with their stimulation. And they usually contain, though, either FSH, follicle stimulating hormone, or luteinizing hormone. And we do have both of those naturally occurring hormones in the body. Sometimes what I see is if something might be preferred, if somebody might benefit from the Menipure because it has a little bit of both versus one of the products that's pure FSH. Oftentimes, most centers, most clinics might be using a combination of the FSH, LH. And there could maybe be, for some reason, potentially a person's history gynecologically, or if they have a hormonal issue, that there might be a need for purely one product or one hormone. That might be the only time. But for the most part, with that recruitment part of your cycle, you usually will see that you'll have FSH and LH. I think the biggest thing that I would say as a patient is your dosage. Your dosage is what is determined for you by your clinic with your nursing and physician team. And that's more what's important, because the idea is the doctors would like to have you be on the lowest dose possible, but to provide the best stimulation for you. And that's where we all differ. That's where each of us has a different age, a different diagnosis, and a different history coming into a practice. And that's where you need to have often a tailor-made cycle for you. So pure FSH versus FSH LH, it's really just a matter of knowing the specifics for that patient with their history that really determines those decisions. And that would be your clinic responsible for that.
Perfect. Thank you so much. I know one of the things that was obviously a question. Sometimes people just want to have questions about how's the product work or why this versus that. And I know we talked about, we're going to try to get as specific as we can without really stepping on the toes of like your specific treatment plan that you might be having at home. But other times people just want to have questions about, giving the shot itself, or if you miss a shot or something like that, just some of those things that you want to get them out of the way now, so you don't have to worry about them later when you're about to give that shot. And just like this next question that comes in that says, what happens if I miss my dose of Menopure for the evening, or if I accidentally, for example, give too many or too few 75 IU vials on a given day? What should I do? Is there an option?
What I would say to that, Craig, is what the patients should do is definitely contact their clinic. There are times sometimes that patients will have an issue when they're at home doing their medication. And I think the biggest thing is never be worried to hide behind a mistake or what you may perceive as a mistake or an error, because oftentimes we are able to, at the clinic, maybe we would check in on you a little bit sooner. Maybe you were, for example, maybe you weren't going to be seen for 2 days from today, and you took a dosage tonight that might have been what you thought was a mistake because it wasn't your exact dose. We might bring you in tomorrow for blood work and ultrasound. So oftentimes I think the biggest thing with that issue about missed dosages, maybe taking more dosage, is to definitely be upfront and open and honest with your clinic about that. And usually your team and your nursing team, they will develop a plan of either monitoring you sooner and maybe potentially changing or adding the dosage or making up for that lost dosage. And sometimes we do that as well. So that's where I think just communication is key.
Perfect. And I know one of the big things, we've talked about this a lot on the Pharmacist program, is that you're probably not the first person to have made any of these type of mistakes. Anything that may have happened, whether it's a missed dose or an extra this or something, and you'll get into some products that have like a very strict timeline around when you should use them, things like that. You're not going to be the first person. So that's why it's a great opportunity here to ask these questions now, so you can get them out of the way, because very rarely are we going to have a situation where Wanda's like, I've never heard of that before. Like, that's never taken place in all my time doing this. So that's what this is great for, is to really ask these types of questions, get them out of the way, but also to kind of put you at ease knowing that your team is there to help you through these types of situations. And that's why always be better to share that information with them as soon as you possibly can. So thank you so much, Wanda. That's an excellent answer, really, to help people feel a little bit more at ease in a situation that can be a little bit nerve-wracking. And speaking of situations that could be a little bit nerve-wracking, this situation has come in many times before. And I know you touched a little bit on the multiple injection sites and situations with like bruising and shifting around that. And this question may have been, kind of jump-started because of that point that you made. And it says, multiple of my various injection sites are getting tender and even a little bit painful. How do you recommend I work around this issue moving forward so as not to make it worse?
So I sometimes do think that patients feel that the area that you sometimes are working with might be a very small, very specific area. And that's why I tried to on the mannequin when I showed that video, give you a broad general area and even with the thighs. So for subcutaneous injections, because there's a belly area and you have a good part of that belly that you can use, if there's one side of that belly that's bothering you, then don't do any shots. And it can be several days that you don't go over there. When we say move it around, we want you to move the injection, know that you have a fair amount of area within a site to use. So I think sometimes the issue here becomes is that patients get very focused on the site and they think that there's not a lot of area around the site. And there is a fair amount of area around these sites sometimes that you can use. So if one thing I would say in that issue is, you know, sometimes I'm a morning nurse at my clinic, so I do see patients at times who come in and they want to confirm that they're using the right area. They might show me a little bruise and I say, that's okay. It's completely normal that you have that. It does happen. Just don't even go near that area of the site and only work with the one other side of the site. So again, don't think that it's so narrowly focused. Talk to your nurse about it. If you need to get seen, you can always come into the clinic. Oftentimes when you're coming in for your morning monitoring at a clinic, that's a great time to do that. And we can take a peek. But just know that usually, even if you have a bruise or a little area, we would allow you to stay away from that area, even if it's for 1, 2, 3 shots. Sometimes some people have a real sensitive side and they don't even use that side at all. And they'll do just one side of their belly and they move it around. That's great. We'll work with that. No worry.
Awesome. No, thanks for really, I mean, that's one of the things I think people are, there's a lot of questions around the anxiety over just the shot itself and really helping to put people at ease, knowing that, you know, if you think of your needle almost just like a dart, the only part of the dartboard isn't just the bullseye, right? There's an entire dartboard. So use your whole dartboard. You have places to work with there. And that's where these types of questions are great, because we don't want people feeling like, oh man, I have to go back into the same spot because they told me I have to rotate and I'm back to that day again. You have a lot of different options to play with. So thank you so much for really, you know, putting people's mind at ease there. And of course, if you have any other questions, follow-ups onto these types of questions, it doesn't just have to be, you could hear somebody ask a question that makes you think of a follow-up question, feel free to jump on. And that's what this whole program is for. So thank you so much for that, Wanda. So a question, and I know you talked about the mixing process and there's the, you know, like you said, the coffee analogy that you gave of coffee to sugar and cream. And this question came in that is, and we've gotten this a couple of times before. I know you've even talked about this, but is there any flexibility regarding how much liquid I should mix with the Menipure powder? I've heard somewhere, but I'm not sure if it's true. Does adding more or less liquid make the injection less painful or uncomfortable?
Okay, so that's a good question. With Menopure specifically, Menopure is a subcutaneous injection. So just sometimes out there, rule of thumb for us oftentimes is that when patients are mixing a subcutaneous injection, because it's fatty tissue and those little vessels are the absorption in that fatty tissue, we sometimes don't want to overwhelm that tissue when it's a little tiny injection. So oftentimes you might see that with your clinic, that's why they're using, like, they may have you mix a 0.5 ml or 1 ml. So 1 ml, 1 cc, 0.5 ml, 0.5 cc. Sometimes you could go to 1.5 ml, 1.5 cc. But oftentimes anything really beyond that is going to be then something that's intramuscular, because that's going a little deeper. That's in that very muscular vascular tissue of the muscle. So what I would say to that is always, again, confirming with your clinic. But in general, if I was to answer that, that's why I'm just giving you like that standard of a 0.5 ml, an ml or cc, or a 1 ml, 1 cc is usually subcutaneous, little needle going into that fatty tissue, because we don't want to overwhelm that fatty tissue for absorption purposes. When you go in a little deeper, then we can increase the fluid amount. So with the Menipure specifically, it's not going to change really your dosage. Is, remember, the powder. That's the medication, not how much liquid you're using. So if you ever did use 1.5 ml, maybe it could dilute it a little bit, but because you're using, remember, sodium chloride with that, which is sterile saline, it's still going to go in that fatty tissue, and sometimes you might feel it a little bit. So I haven't been asked that question. If I use a little more fluid, will it be a little less stinging? And not necessarily with that, in terms of that as being one of the solutions. So as always, I would want you to know that you should talk to your clinic and utilize the amounts that they're having you use for mixing your powder. But sometimes it's really the powder. I think that's the big emphasis that we always have to tell patients with that medication. It's the powder that's your dosage, not the liquid amount. The liquid amount is just dissolving that powder.
Great. Thank you so much for explaining that and for giving such a great answer to that question. And at this point in time, we have actually gotten through the questions that have come through. We, as always, want to make sure that everyone has a chance to get their questions answered. So don't feel like you have to rush to get it in before we move on to the next product, because you'll have plenty of time to ask your questions throughout the course of this whole program. We open it up at the end for questions about any of the products that we've talked about, and any kind of tangentially related questions as well. But in the meantime, if somebody is trying to get that last question in, let's just give another 30 seconds or so for them to type it in, and I'll throw it back over to you, Wanda, just if there's anything else you wanted to share before we get ready to move on to the next question, if somebody is trying to get a question out there.
So with Menopure, what I just would want to emphasize is don't be intimidated by the mixing process. I think it's real important that you just know that watch the video a couple times if you have to. Take it slow the first night, but you really will get into your own system and your own little groove, if you will, with your mixing. So at first, I think that is the biggest intimidation factor with a mixing product. But really, once you get that one night of mixing down your belt, I think you feel a lot more comfortable with the mixing. So don't be afraid that the Menipure is the mixing medication. It is, but it's definitely something that, as you could see with that video, just knowing the steps and watching the video with your steps and your supplies is, I think, the biggest thing you can do to make that a much simpler process.
Sounds great. All right, so we are all caught up right now, so there are no additional questions for the Menopure. So let's get ready to move on to the second product.
Okay, so our second product is going to be the progesterone injection. Progesterone is a medication that you take for utilizing, I should say what it's utilized for is to help the uterus. It's preparation of the uterus for implantation of possibly the embryo being implanted into the uterus after an egg retrieval. Sometimes some people are taking this after, maybe you might be doing injectable after an intrauterine insemination. So progesterone, the injectable progesterone, is really helping to prepare our lining of our uterus, thickening the lining of the uterus in preparation for fertilized egg, embryo, to then have a nice environment to grow and develop. And so what you'll see with this medication is there's no mixing, comparing it to the Menopure. There's not mixing with this. It already comes in liquid form. And so you'll simply be drawing up a dosage, which is taking out one step, which is rather nice. The only issue that you might notice with this particular product is the injection technique that I will be reviewing. This one is now an intramuscular shot. So this one, you're typically going to use the upper outer quadrant of the buttocks. We're not usually utilizing the leg, front of the leg, or the thigh, and we're not utilizing the belly. So the big, nice, non-weight bearing muscle that we're using is that glute muscle, and that's the muscle that you'll see the technique. So Craig, if you're ready, you can roll that video. This medication video is to show you how to properly mix and draw up and inject a progesterone injection. With progesterone, why am I taking that? Probably is the biggest thing that we get asked first in the fertility clinics. And with progesterone, what you want to know is that's a key medication to helping the lining of the uterus be well supported and nourished while an embryo is looking to attach and implant for successful implantation. So medications that help that, progesterone being one of them, is used in your fertility cycle, and it's used to help in and around that embryo transfer so that your body has everything it needs in hopeful implantation for successful pregnancy. So that's the first thing you want to know about progesterone. The other thing to know is progesterone is administered into the buttock muscle. The reason sometimes with this medication that we often have patients ask about other areas, though, I was going to say, is that, we use the buttock muscle because it's a big non-weight bearing muscle. I think I do get asked a lot, can I use my quadriceps? Your quadriceps, and I'm standing here marching in place, if I had to lift up legs that were getting progesterone shots, it might be a little difficult to do that. So the idea is that you want it in a nice muscle that's great for absorption, but doesn't have weight bearing on it. And that's what those quadricep muscles have, is that they have to lift the leg. The other thing is the deltoid muscles, where we might get flu shots. Not a great muscle to use for a progesterone shot, simply because it's just too much for these little muscles to handle. And again, these hands and arms have to be raised up, and then you're using that muscle to do that, lifting, grabbing something, and it would just be way too much. So just to confirm that the location is always going to be the gluteal muscle. And the nurses at most of the clinics, even like ours, we definitely, what we do is we try to do our best to help give you a circle on both sides of the buttock, the left and right. Because the thing to know about progesterone is usually you are on it for several days, sometimes it even can be a couple weeks. And the reason for that is in early pregnancy, it's what's helping keep that lining well supported, again, where that pregnancy is growing until we have a placenta that takes over, which is the mom-baby connection. So that's its key importance, and why you might be on it a little longer than some of the other ones is because that little phase takes a little while for that placenta to fully function. So the progesterone in oil is an injection that it's intramuscular in the buttock. It is used to help support the lining for hopeful pregnancy and nourish and give everything that that embryo could need to have a successful implantation. And it is also something that typically we would recommend that you have somebody administer to you. I'm not going to say I haven't ever helped somebody who had to do their own injection, but when it comes to muscle shots, if you have somebody that can inject and give you the shot, it just takes a little bit of that pressure off. The one thing I will mention is sometimes patients want little hints or help with this shot because they might have heard things about it. First thing I would say, as far as storage goes, it's really important that your vials of progesterone do not get refrigerated. So one of the things I will mention about that is when you get that nice big box from your pharmacy, possibly Mandel's, don't be afraid of it. Okay, guys, you have to open that box because human hands packed it. So you want to take that packing slip out and you want to just look to see quantity of what they've sent. That's really what a packing slip is, just like if we ordered something from Amazon. So what you want to know is it's really a good idea to open up that box, take a peek at it, see that you've got everything that it says has been sent to you, and hold off. You don't have to look through everything right away. But one of the things that I would say, particularly with progesterone, is that typically it's in an oil base. So oftentimes it's very important that it just maintains at a room temperature. So feel free to contact us if you have any other further questions, and contact your pharmacy when you do receive this medication. But definitely get it out of the box and leave it on that counter, or leave it in a safe shelf where nobody will get at it. One of the other things I'll just mention is at our clinic, we're okay with letting you use the old tried and true, a little bit of ice to the area. And you're not over icing when you administer for this. You're just going to give a little ice to the area before the injection, and that helps just numb it so that you don't feel any pinch of the needle going in. So ice everybody has available to them at their home. So just know that that's one of the things that I will talk about again, but just to let you know that you can use prior to administering in that glute muscle, is to apply a little bit of ice. And we'll also talk about another product that I'll be just showing you here, is just to let you know that there are Sinera patches, which are also helpful sometimes for people that sometimes have difficulty with getting blood drawn, and they've got a lot of anticipation based on that. It is a numbing type of cream patch that you put on to the area. So we'll talk about that later, but I just want to let you know there's some other options that you can talk to your clinic and to your nurse about in case you're having troubles with those injections. So with the progesterone, the next thing that we need to know are the supplies. And so once again, our little list here is for progesterone, we need 1 vial of progesterone in oil, and oftentimes it might come in a box that'll say right on there, progesterone. You will need 1 3cc milliliter syringe, and there may be definitely a needle attached to that. So keep that handy. You'll need that 1 syringe, and that needle that's usually attached is this 122 gauge inch injection needle. That's usually what is already attached to that. If your syringe comes separately without a needle attached, you would need the 3cc, 3 ml syringe, and separately a little package of a 22 gauge 1.5 inch or 1 inch needle. Most often, most of us need a 1.5 inch needle, but there are times that some patients are rather petite and we can order a little bit smaller needle for them that'll still get into their muscle. But most of us technically need that 1.5 inch to get to muscle. And then 1 18 gauge pink needle. It's usually pink in color, a little pink on the label here. It might be hard to see that in color, but just to let you know, it's a pink needle. I want you to know that that is a big needle that looks like a nail. Never, ever, ever would we ever want you to have to do that as an injection needle. So just know if you see that when you open that box from your pharmacy, please do not panic. That pink needle is simply to help draw up the medication. And it makes it a lot easier when something's thicker in that vial, a little bit thicker oil substance, helping you draw it up from that vial is really easier with the pink needle, but then you discard that pink needle. Never, never, never do you need to have an injection with that. You just don't want to put that into the muscle, okay? So always, always, always ask if you're ever concerned and you just saw that needle and you forgot, what the heck is that for? And you're panicking that that has to be administered into your muscle. It does not. So it goes into the bottle only. So with all of our medications, as I mentioned, it is not a sterile technique to mix or administer medications, but it's always a clean one. So what you want to do is have nice clean hands after you get your supply. So you can clean with soap and water, or you can take a little bit of hand sanitizer and sanitize your hands before you are going to work with that medication and prepare it for injection. So with our bottle of progesterone, there'll be a plastic cap that we snap off. Okay, under there, what you want to know is it usually is sterile after you open it the first time, but this is what we call a multi-dose vial. You are going to use the contents of this vial potentially until it's empty. So because of that, each and every time you want to clean the top with a little alcohol. And if you get these little prep pads, you can use them. The other thing I would say to that is if you don't have prep pads, regular bottle of alcohol, isopropyl alcohol with cotton balls will do. So you don't have to have these little prep pads. If you don't, it's okay. But most of the pharmacies, and I know the pharmacy Mandel's, they do supply this to their customers. So I just want you to know that they will probably be in there for you to utilize. Once you clean the top off, the next step is to take the needle and syringe that may be coming together, or if it's just a syringe, whichever, you need just the syringe to start. So what I always do is, this is in a little sterile package, and when you open it up, you can hold your hand on the needle, pull back the packaging, and just twist off the syringe. And you can leave that needle in there safely. That's our injection needle, so we'll leave it in there until we're ready for it. And then what we're going to do is we're going to take the pink needle, open it up from its package, and we're going to twist that gently on to the syringe. Don't over tighten, because remember, we're going to remove that needle, so we don't want to have it where we can't get it off. So you want to gently tighten it, and that big pink needle is what we're ready to go, and it draw up a dose of medication that we need to administer. Typically what I'll show you is a typical dose is 50 milligrams, which in terms of a liquid amount is a milliliter, 1 milliliter, or 1 cubic centimeter. So a cc and an ml is the same. That's the other thing, that a lot of us nurses have different lingo with that. So some nurses will say take 1 cc, and the patient may have been hearing from another nurse that said 1 ml. So a milliliter is equivalent to a cubic centimeter. So 1 cc is equivalent to 1 ml. Probably a good side note to know that, because we all do have our own little lingo, and I don't want that to throw you off. So I'm going to draw up some air. And the reason I always just do that is because there always can be a little pressure in the vial. So however much liquid you're going to take from that vial, you inject that much air. So you draw down and line up the rim of that plunger to that number 1. If you're doing a dosage of 1 ml, 1 cc, if you're doing anything more than that, your clinic is going to let you know that. So you'll always be following your directions of your clinic. And then what we do is we insert that needle straight into that vial. We push up on the bottle and inject a little bit of that air. And then we draw down and fill up to the 1 ml. With this one, you don't often find that you'll have bubbles because it's not a water base. Being an oil base, there might be a little less bubbles in there. So sometimes you might hear about air and having to flick out any air. Not typical that you're going to have to do that with this medication, okay? So you can remove the needle. The bottle, you will use it again until this bottle's empty. So remember, multi-dose bottle. Put it away. When you need it for the next injection, when you take it out, you clean the top off. You don't have to cover the top, but you're always going to clean with alcohol before you poke a needle through it, okay? So multi-dose vials are good because you don't have to use many different items and supplies. You want to then safely cap this needle. The pink needle is going to come off, and then I'm going to discard that in my sharps container. You'll have a red sharps container from your pharmacy typically to keep safe all of your needle tips and all of your syringes. And then what we're going to do is take the injection needle and now twist that on gently to get ready to administer. So now we have our medication and our injection needle ready to go. A little hint, some people do, I've taught this many years, so it's no right or wrong, just some little tips you could do. If you'd like to, you can roll this syringe in your hand. Because it's an oil base, sometimes people hear that, what can I do to kind of help with that injection when it goes into the muscle? And what can I do to help it absorb or break down into the muscle? So because this is a little bit of a thicker solution, you know, certainly that's the reason why it takes a little bit longer to have it break down. So one of the little tricks could be this rolling, because just the friction and the heat from your hand can do that. I know some clinics might even actually recommend that you could take your tap water, run warm tap water, and the needle's covered that's sterile, and you can run it over a little bit of warm tap water to just, again, once again, do what you can to sort of, it's to make it a little less thick when you go to give that injection, okay? So those are just some little tips that you can try to see if they help you, and I hope that they can, with this injection, help you. The other thing that is a little tip that I know we do at our clinic is, I'll just get my mannequin. This is an injection that's going to go now into the muscle area. Pardon me, she's losing her undies or underwear. This is, the side here is open to show that the red is the muscle. That's why we need a longer needle, because we need to get into that muscle. And all of us have a little pinching of fat. So the yellow is fatty tissue, the red is the muscle, and that's the sciatic nerve. But the nice thing is when your clinics and the nurses there are marking you, which a lot of times all the clinics do that, they are marking the appropriate area that you're going to need in your gluteus muscle. So what you want to know is we're marking what's called the upper outer quadrant of the buttocks to administer that shot. So you don't even have to worry about that sciatic nerve, because you know where we're usually marking you is going to be free and clear of any of that. Keep in mind that when you get this injection, the administration of the needle is something that we'll talk about. You might feel a little pinch if you don't ice the area, or if you don't use one of the Sinera patches, which helps to sort of numb it. If you don't do either of those, then you would feel a pinch with the needle. You might feel a little bit of pressure when the fluid goes in, but it's very fleeting because you're not putting in a lot of fluid or a lot of medication. Really with muscle shots, it's the next day. And any of us that have had flu shots or anything, vaccines in our arms at times, you know that your arm feels a little heavy or a little just tired. Or when you work out at the gym and your glutes are a little sore, that's really what you should potentially feel after a muscle shot. There should never be redness, warm to touch, itching, swelling, severe pain. And if there is, always contact your center and speak to your center's, your nurse and or your team, because they would want to know about that. Because we don't want you to feel as though that is a normal symptom that we should feel after we administer these shots. A little soreness, and you should be able to rub at the glute with your hand, but anything more than that, definitely that's something that you can report to your nurse in your clinic. The other little thing that I'll mention about after the injection that's a good idea is gentle massage. Some people even use the foam rollers from their exercising to sort of roll over the area a little bit. If you have a handheld massager that's got some heat, that's great. A little bit of warm, moist heat. These are all things that are just comforting to the muscle, and it just helps. So what you'll find with this injection when we do have to administer is the nurses will hopefully have helped you with where to give it and have circled that area. And usually we put circles on both sides, and we do it in Sharpie pen, and you can retrace it because it'll fade a little bit in the shower, but it usually doesn't ever go fully away unless you really are rubbing at it to, you know, with soapy water and such. So it'll fade a little bit, but you can retrace. And you want to move the injection around each evening to a different side. You would want to alternate right, left, left, right, and within that circle, moving the injection around, just so that it gets to all of the muscle and it's not so difficult that it's having a difficult time breaking down, okay? With this medication, as I mentioned, it is intramuscular in this glute, so it is recommended if somebody could administer the shot to you. If you want to, you could stand for the injection. If you stand for the injection, if somebody was administering into my right glute, what I would do is I would stand and put all my weight on the left side, and I would just lightly touch down my right leg. What I'm trying to accomplish with that, if I stand, is I want a relaxed muscle. So that's one way you can do it if you'd like to stand. If you don't want to stand, then what you could do if I were administering, and this was a real person here that I would be administrating, her front of her body would be facing you, and the back here where I need to administer is facing me, and I would administer. She's laying down, so her muscle is already relaxed. So key thing with progesterone shot is a nice relaxed muscle, so that just it's nice and easy going in. And again, if you're using a Sinera patch or a little ice, if you do any icing, we always do recommend, though, do not over ice. There's no reason for that. You could just do a couple minutes on your timer on your phone, and that'll numb the surface so that you don't feel the pinch. A little bit of the soreness that you feel, what helps with that really is warm, moist heat, gentle massage, even, like I said, walking around, activating that muscle, but you'll feel it a little bit, but it's not excruciating, and it should never be that you can't sit, walk, sleep, etc. It should never interfere with daily activity. That's important. And if it is, then please notify your clinic's nurse team, okay? So if I'm ready to do my progesterone shot and I have the area and I've iced it already and I'm giving this to someone, I'm going to take my cotton ball with alcohol and I'm going to clean that whole little area. My next step is going to be to uncap my needle. I know this looks a little scary. What I want to say to you is literally the little tip is what's sharp. We don't really, when we're given a shot, we don't sense how deep it is. We sense when it went in. So if that helps you to kind of understand that, I understand completely by looking at the size of the needle, but I want to help to relay that it's the tip when it goes in will feel like a pinch, like when you get your blood drawn, okay? With this one, we do not need to pinch and gather the skin. We actually are going to keep our hands away from that area so we don't get hit, but you could open up, do a little L with your hand and wrap it around. Remember, I would be behind this person if they were standing, and if she's laying down, I would have her on her side and I could be sitting. But in this little video here, I kind of have the angle of this needle going in at roughly a 45-degree angle. The needle going into the body in my hand is in a 45-degree angle. It is not pointed, the needle down to the floor, and it's not parallel to the floor. It's roughly 45-degree. No jabbing. That's not necessary to trauma the skin. Place the needle to the skin and give it a little gentle push. The needle goes all the way in, because that's a question I always get asked, and it needs to go in to get into the muscle. What you then do is take your hand that was wrapped around the hip and hold that needle in place, and you're going to pull back gently on the plunger. When you pull back gently, what you're looking to not see is any blood enter the syringe. And I want to let you know that it's very rare to happen. I think in my 26 nursing year career, I've maybe hit once or twice where I gave a shot and it even hit a vessel or a little vein. It's okay. If it does go in and you notice it and the blood enters here, not a problem. You haven't injected anything yet. However, what you want to do is remove the needle. What we have you do is remove the needle completely, change the needle tip. You can use the medication because it's going into the same person and go to the other side and reattempt to administer. It'd be highly unlikely to have that happen a second time, okay, just to reassure you of that. But if you pull back and you do see blood, just stop, think of a stop sign, remove the needle completely. You'd put a little cotton ball there, put a little Band-Aid if you need to, and then go to the other side, but change the needle tip because the needle only goes into the body once and comes out once. It doesn't go back and forth and in several times. So when you pull back, what you're mostly going to see is nothing. There's no change in the color of this liquid because oftentimes you're in that good spot that's been marked for you. And then you just gently push, and it's going to take a few seconds with the progesterone because it's a little bit thicker, but you push it all the way in. You can do a little 1, 2, 3, and then you remove the needle in the same angle as you inserted it, gently from the skin. You remove it, set it down. Don't panic if you see a little oil coming out or a little blood. Put pressure and hold that cotton ball there for 10 seconds. Here's where some people like to put Band-Aids on, some other people don't. All I will say about Band-Aids is don't leave them on in the morning all day until you do your next shot the next day or anything like that, because you will get rashes from some of those Band-Aids even if you don't have a latex allergy. So put the Band-Aid on if you're getting dressed and you just don't want to soil your clothing, but at some point take it off, kind of like we do with our arm. We don't walk around with that, you know, gauze and Band-Aid there. It's just there to pressure to help that bleeding stop, but this is not even going in a vein. This is going in muscle, so it'll stop pretty quickly, okay? And then remember, with progesterone, that you can find out from your clinic what they would like you to do, if they would like to add in a Sinera patch that we'll be talking about at some point on the videos here, or just want you to use a little bit of ice. But post-injection, the key to that is just a little moist heat, a little warmth, a little gentle massage. But the ice really can help with the pinch. And the nurses marking the area, I think, gives you a lot more confidence in knowing where it is that you need to go. Okay? So remember this. This is a shot that when you're taking this for several weeks, you have a nice pregnancy. So the whole goal of your fertility cycle is now manifesting, and when you're doing those injections, a lot of people don't want to get off the shots because they're concerned about doing that for their pregnancy, but you don't have to worry. When you come off those shots, it's a nice reprieve, but you've been doing them and you have a good reason to be doing them. So best of luck with you. I hope these tips help you with the mixing and the administration of progesterone. So that was the progesterone video. Hopefully, again, like the Menipure, you found that helpful. It was nice of a comparative to the Menopure because it was nice to see something that was mixed versus a non-mixed medication that you simply draw up. And also nice to see the two varieties of injection technique, which are the two varieties that we generally have you injecting, is either a subcutaneous or an intramuscular shot. I do know that intramuscular shots are not always easy. And so anything that I could do in that video to help sort of alleviate that concern, we tried to go over for you. But I know that there might be some questions out there, Craig, that individuals might have regarding this medication.
Yeah, so a couple of these, I think this first one, just, I know you touched on this, and we oftentimes with progesterone and oil, this comes up where people just have a little bit more questions on how it actually works, just because you did explain it. But sometimes, you know, people are sitting there trying to, a lot of information coming at them, and maybe they didn't pick up on this. So it came in a couple of times, but people said, can you just explain one more time the purpose of progesterone and oil? How does it work? I know you said it's a positive thing at this point, but what's the purpose of what it's doing at that point?
So with your natural cycles, I think if we have maybe a little understanding of something that happens in our bodies that you may not realize. So when you have an ovulation naturally in your body, what happens after you ovulate is in your luteal phase versus follicular phase, which is what the Menopure is a part of. The Menopure is part of the follicular recruitment, the follicles, the growing, the development of the eggs. And then at some point we have an ovulatory hormone in the middle there that we haven't gone over in these videos, but we will. An ovulatory hormone, or even in a natural cycle, you ovulate. The progesterone is the hormone that increases in our bodies after ovulation. So remember we talked about FSH and LH being naturally occurring hormones. Well, progesterone is something that is developing in our bodies after an ovulation. and it's allowing for then once a sperm and an egg are in union, whether it be a natural pregnancy, whether it be a fertility cycle with using IVF and an embryo has been put together, a sperm and egg have been put together in the laboratory, and then an embryo is placed in the uterus. All of this is about uterine preparation, and getting that uterus ready for being in a good place, or thickening the walls of the uterus, preparing them hormonally for the environment of a pregnancy that grows and develops. So our pregnancy, once we're pregnant, ladies, it's in our uterus. It's where it's going to be for the next 9 months. And at the very start of all of it, the key part of that is creating the environment to get us there. And that's what the progesterone is doing, is influencing that lining in that very early part of conception.
Perfect. Thank you so much for just touching on that again, because I know sometimes there's a lot of information in some of these, and we do want to remind you again, this is something that I know, Wanda, you had mentioned before, but not only are these full videos available, but the individual product videos are available. So you can watch this now and kind of get a chance to ask your questions and to listen to multiple products and tie things together that way. But then we also want there to be the ability when, let's say right before that first day you're about to give a shot, you can just log right on, check out just the specific product that you're about to give a shot of, and just say, let me just make sure I didn't miss something. So we didn't say it earlier that you shouldn't be sitting here like feeling like you have to frantically you're scribbling out notes on everything that we're talking about, because you can watch these as many times as you want. But this is a good time to remind everybody that these are great questions to ask, so that you can really be comfortable and ready when you're about to give that first shot of the, in this case, like the progesterone and oil. So great answer. Thank you so much. And another thing about storing and some of the ways that it can impact the actual, the product itself. And we know a lot of these questions come up with specifically intramuscular products just because they're different. There's a little bit more nerves involved here. The people get a little bit more nervous about, will it hurt more, or will, can I mess it up or not, or whatever. And so this one we have seen before, but it said, I've heard that storing progesterone in oil in certain ways can make it thicker and more uncomfortable to inject. But I can't remember if that was because I saw that it was too cold, not cold enough, etc. How can I prevent this issue from happening to me before my first shot?
Absolutely. That's a really good question. And probably just to go back to my own comment in the very beginning of the talk tonight, was opening up your box of medications, because sometimes there is a label on the outside that might say contents needs to be refrigerated, because there might be some products that are in and a part of your medication repertoire that might need refrigeration, some might not. So the reason the box will be labeled as such is because they have to address those that might be, and Mandel's Pharmacy as well, they will put in there ice packs and things that need to keep those medications at their proper temperature. But what it is with progesterone is what you want to do is, a lot of the medications you might not even need to put in the refrigerator. Every medication you have will have a storage description. And so particularly with progesterone, it might be labeled for you to store at room temperature. And progesterone, if you get the oil variety, that's the reason you're storing it at room temperature, is because it can thicken a little bit. Think of if you just took your bottle of olive oil and maybe stuck it in your refrigerator, do that for a couple days and you'll see what happens. It definitely thickens, it changes color. So the idea is that if this is an injection, we want to keep it in that liquid form. So we want to make sure with the oil that you are keeping it stored at room temperature. So definitely go through that box and just make sure that because a lot of times that question will come up is, how do I store it? And that's where we often are relying upon the pharmacists at Mandel's Pharmacy, because they are labeling these medications when they are sent out to you with those specific instructions. And also on any box of medication, it'll also say storage. So just know that that's why that's helpful. But with progesterone, particularly the oil variety, you do want to keep it at room temperature so it stays in liquid form. And then that way there it won't be thick.
Thank you very much. That's great. And I think these are the types of things that people are, making sure you get this stuff out of the way now, so that you don't have to deal with it later. But storage is a thing that you have to make sure you're taking care of it right out of the gate as soon as you receive it the right way. And that's why opening up that box, there's a reason why we pack it together. We put a whole list in there. We kind of welcome you to everything that Mandel's is going to be a part of your entire cycle with you. And we want you to make sure that you understand what's in there, And I love the way that you said, almost just like an Amazon box. It's like, we want people to be just as excited about receiving this box, if not more so, than they are when you get whatever that thing is that you just ordered for yourself for the holidays on Amazon, because it was on sale at the end of the year. And this is that type of box that you want to be very excited that you open it up right away, you know what's in there. And if you have any questions, that's the time where you can look into it, so you're not worried about it that moment right before you're giving the shot and you realize, oh no, if you just open it up right before you're ready to go, that's going to be a huge mistake that you're missing out on. So thanks for reminding everybody on that again. That's really important, Wanda. Okay, so probably one of the other big questions, we had this come up before with Menopure, and it comes up again here, and this is about if people potentially miss shots or things like that. And this says, what happens if I miss a shot of my progesterone and oil altogether? Do I make it up next time, or do I just skip it?
That is a good question. And that is one of those questions that I would definitely suggest, by all means, being transparent, not hiding behind what you think is a mistake. And you're just, you might be nervous to say and own up to it. Don't be afraid at all. Own up to that. Generally speaking, if you mix one injection, it should not be anything that we worry for you in that case of a make or break. As I said, even with Menopure, we might adjust something. So there is a possibility that a dosage adjustment could occur, but oftentimes it usually won't need to be. If it's, where you're missing multiple days or something of that nature, or you're really not taking the appropriate dosage, then that's really an important thing to own. You need to be knowing that with fertility, I think the biggest thing and a biggest part of a nurse's day is providing her patient with accurate medication instructions, so that you can be doing everything you can with your cycle. So it is something that is a very important part of your cycle in terms of you taking the appropriate dose. And if you ever miss a dose, is always just own it. That's what's key. And as I said, with progesterone, if you miss one day, it's usually not a make or break of any sort, but your clinic would address that. Maybe they would have you increase a dose or make it up in the next dosage, possibly. But I want you to know that that's something that is easily fixable as long as we know about it. I think the biggest thing with anything is we can't fix what we don't know about. So if you let us know something, we can always do our best to fix and accommodate and try to adjust.
Definitely. No, that's great. And I think part and parcel with what happens at the pharmacy as well, our mandate is always going to be that we'd rather you ask a question twice beforehand than not at all. And that's always going to be a thing that's what these programs are all about, is to make you feel comfortable asking questions, because to our point earlier, whatever question you ask, it is almost 100% certain that it's not going to be the first time that your nurse has heard that question. So they will know how to help you, but they can't help you if you wait till after the fact and you don't say anything, right? So you just gotta make sure you're asking those questions and ask 2 or 3 times if you make sure you want to, understand the answer rather than not asking at all. So great. And then this one, speaking of questions, is pretty basic one. What is the difference between the different possible mixtures, the sesame oil, ethyl oleate, etc.? Anything I need to know about them?
Okay, good question. Progesterone can have different base solutions that the medication is suspended in for delivery. And oftentimes it is in an oil base. And so in a nutshell, really what I will say to you is that if you have most of the times, and I can speak for my own clinic, and I'm sure this happens in other clinics, but I'm just speaking for mine. We oftentimes will ask you about allergies to anything, but one of them might be, we're looking at a specific, maybe you have a peanut allergy or certain peanuts, tree nuts, something like that. We're asking that, and particularly in this case, we might want to know about that because with the progesterone, there is the oil that you obviously might take, and most patients are on the oil, but anybody that does have an allergy, there is an alternative to that. A medication I shouldn't say a medication, a base solution of ethyl oleate. And that is where your progesterone is still in a bottle and it's still drawn up like you do with the progesterone and oil. Instead of being in an oil base, you're in the ethyl oleate base. So it's just a different medium used in order to provide you with the same medication. So I think that's really important when people worry about allergies is, oh my gosh, can I not do my fertility injectable drug and support my lining of my uterus because I have an allergy? And I would want to say to you, no. That's one of the big things that we talk to the pharmacies about. And a lot of times the pharmacies might want to know any allergy status as well.
Great. All right. Sounds good. With that all being said, we have actually gotten to all of the questions that have come in so far. So what we'll do is, again, just give another quick 30 seconds for anyone if they're trying to get some questions in right now. I know progesterone can be a bit of a can be a bit of a complicated product for some people, so there might be some extra questions. So we'll give another 30 seconds and then get ready to move on to the third and final product. So back to you, Wanda, if there's anything you want to share as we give people a little bit longer to get those questions in.
Yeah, I would just want to add to it and just say that don't let the progesterone shot get in your way of reaching your goal of getting through a fertility cycle and in hopes of achieving pregnancy. Remember that we're all individuals and how we experience things can be slightly different. And I think sometimes for some people, their body might be a little more sensitive to injections, which the next medication, we're going to talk about that, that could maybe help in that case. But I think I often hear a patient will say to me that before they even start their cycle, they're already talking about the progesterone injection, and they've already got some worry about the intramuscular shot. And so I just want to let you know that there is a beginning and an end to progesterone. You are not on it for a lengthy period of time, but yes, you might be on it for maybe a couple weeks because that's in part a part of that fertility cycle. But I really think it's important to know it's not like being a diabetic and being on an injectable insulin product for the rest of your life. This is a product that you start and you finish. And when you leave us having finished taking it, you are leaving us with a nice, hopefully nice, healthy pregnancy, and you're off to your OBGYN. So what can be better than that?
Awesome. Thank you very much, Wanda. I think with that, we are all wrapped up with the questions that have come in so far. So we can get ready to move on to the third and final product. And again, obviously, if you think of any questions out there, everybody, you can feel free to ask them in the final Q&A segment that we will have after this upcoming product. So back to you to get us ready.
Okay. So the next medication that we're going to show you is one that I actually showed the box earlier. It is called Sinera. These are some patches that you happen to use if you are having some nervousness or some distress over the needle sticks, maybe the blood draws, or even these injections of progesterone, or even any of the injections. You certainly can talk to your clinic and your team to see if this is something that we could order for you on your behalf. And main thing is that it's used as a numbing agent to the area that you might be injecting in, or possibly getting a needle stick for a blood draw. So let's take a look at that video so we can share how that progesterone patch, how that Sinera patch works. Hi everyone, this video is to give you some instruction for using a numbing patch that's available to you if you have difficulties with having shots administered and you're very concerned, or sometimes some people have a tough time getting their blood drawn. And this can be a useful patch to have your center call into the pharmacy, and the pharmacy will check and see what your coverage is for it. But the idea with the patch is just to give you another option of something that might help you in alleviating any fears about blood draws or medication administration. So this medication is called Sinera. It comes in a box that will look like this. Oops, pardon me. Let me put it the right way. And then there are, I believe, 10 patches in here per box. Each patch is a one-time use. So you don't reuse the product. Once you apply it, kind of think of a Band-Aid. You apply a Band-Aid and it might get soiled after you discard it. So each patch is a one-time usage patch. And so when you are applying this to have either a blood draw, okay, or to an area that might be getting injections, which sometimes for fertility mainly could be the buttock area. Some people might want to apply it for the little areas, shots that are in the belly or the upper thigh. But once you get the okay and you have a prescription that does get called in for you, what you want to know is, make sure that the skin area that you're putting this on is not having any cuts or any abrasions or anything that's an open wound. You want it to be clean skin, but you definitely want to make sure that you have no no cuts or abrasions or anything like that on those areas. So you would clean the skin first and foremost. And what you'll see is the patches come in a packet, and you will open up that foil pouch, and you'll remove the patch and place it with the foil side up. What you'll find here is there is a little sticky, I should say there's a little sticky area here that I will pull off, and then there's a little a harder plastic area. When this goes on is typically 20 to 30 minutes prior to getting a blood draw or getting a medication administered. So you want to apply it to that area. Careful that you don't touch the area that has, you'll notice that there's some little dots in here where it breathes, the Band-Aid. But once I remove this, like a lot of times even Band-Aids that mine have a little bit of medicated Neosporin already in them or whatever, you don't want to touch that area. So same with this, is that you don't want to touch that area. And then you peel it back and off. And so this is the part that's going to stick to the body. And then just for the sake of my demonstration, what I'll do is I'll grab my mannequin that I have. And if we were going to have her, you know, for her muscle shot, utilize this, we would take the foil side down, not touching it, and apply it 20 to 30 minutes before where she's going to get her injection. And she would leave it on, or she would apply it, I should say. She would apply it to that area, leave it on there for 20 to 30 minutes, and then remove it prior to the injection. When you do go to remove this, what I want you to be careful of again is not touching the inner aspects, that silver part. And so in order for that to be safe for you from animals, from other children or anybody, is your packaging. What's nice is you can just apply it to that packaging and then discard. So save the outer foil pouch to be able to utilize that for discarding your patch safely. So there's a bit of numbing cream, lidocaine, there's a little bit in here. And what those, like I said, those numbing agents can be helpful for some people who maybe really have a potential needle phobia, very concerned about their injections, even, you know, might be a little bit of a difficult blood stick. So this is something that you can always talk and discuss with your fertility clinic, your nurse, your team, and let them know your concerns, because I think all of us would agree that we want you to be able to get through your cycle. We want to do everything we can to empower you to feel comfortable. And so if this is something that is going to help you to make that next step and take that next step to the fertility journey, then we want you to know there's some things out there for you that can help. Thank you again, and best of luck on your journey with your fertility cycle. So that was the Sinera for everybody to see that product. And I know we might have some questions about that one. I mean, it was a pretty quick one to show. So I know it's probably not a lot I can expand upon unless the questions help me expand a little further.
Yeah, just a little bit of one of the things you did touch on, but I guess there's just some people wanted to have a little bit more information about how the Sinera patch is actually working. So one of the ways it came in was just, how does the Sinera patch actually work to help with the pain? What is it doing? Is it equal to or better than simply applying a heated pad or a cooling pad before I give my shot?
I mean, it could be better for people who might have a difficult stick. Like I said, we can tell you that if you don't, you know, sometimes some people may have to pay out of pocket for something and incur a little bit of an expense to them if it's not covered. So I wouldn't want somebody to feel like they have to have this patch, because they could do the little tried and true with some ice. But sometimes there are people that have difficult phobias, needle worries, and needle stick worries, and they've been a difficult blood draw. So I think it's a great adjunctive therapy for that. And so with it, what it is it has two numbing agents in there. And when it is applied, it is going to, where maybe people are talking about the heating too, is that you can even feel a little bit of that in that area of where that patch has been applied, because it actually will warm it up. The warming up of that area by the numbing agents allows for the delivery. So heat alone isn't necessarily really going to take away pain from a stick. A little bit of ice naturally could do that. But the main thing with Sinera that I would say that's different from both of those is that it is a pharmacological numbing cream. So it really is numbing the area. That's the difference.
Perfect. Thank you so much. This question often comes up pretty often, and I know you've even talked about it on as well. We've had this conversation, but just because of the nature of it being something that helps with pain, question comes up that says, is it possible to overdose with the Sinera patch? Do I need to be exact with the timing when I take it off, when I put it on, so on and so forth?
Yeah, we have looked at that, or it's been explained to me that, you do put it on 20 to 30 minutes beforehand. I think if anything, if you didn't put it on for long enough, a patch before your shot or your needle stick, it's still going to provide numbing. It just, maybe you could potentially feel a little bit of that. So you want to follow the direction of what the maker has studied. Is certainly they're giving you a guideline, giving us a guideline to provide of 20, 30 minutes. But if you were to leave it on for 45 minutes, is there an issue? No, I mean, there's not really an issue with that. If it's on a little bit longer, it's still going to provide what it needs to, but it's not necessary. I guess that's the key too, is that sometimes, just so that even with a Band-Aid, you could get a little redness from a bandage. So if you leave it on a little longer, it could look a little red or a little pink, maybe because you're leaving it on longer, but that's more related to the sticky part of the bandage itself. But it's not going to be that it's an overdosing of sorts. And you don't need to apply a second patch. Your one patch is okay, either at the 20, 30 minutes, and even just that one patch if it's on a little longer, but you wouldn't want to put that patch, take it off after 20, 30 minutes and apply maybe another patch, because you really don't necessarily need all of that. And you don't want to waste the patch. For sure, you want it. It's a one-time use, and it should do its job just one time.
Perfect. Thank you very much. Yeah, I know as you mentioned, they did do testing to see with many times over that amount that you just mentioned, the 20 to 30 minutes using one patch, multiple patches for much longer, and there wasn't any. It didn't even come close to any levels that could cause like a risk that somebody should be worried about. So obviously, still use it within that time, parameter and the amount that they're telling you to do. There's a reason why that testing was done. But it's not like something like, oh my God, I left it on for 2 more minutes. Like, is it going to be, did I take too much? It's not
exactly
like that.
Exactly.
Perfect. Well, as you said, this one is a little bit of an easier one. It's kind of it's a patch and you put it on and take it off. So there's not as many questions. So it seems like everyone seems to be okay with the overall presentation. We haven't gotten a ton of any other questions really aren't coming in right now. So what we'll do is, like I said, we'll give people another like 20, 30 seconds if you're thinking of something. But in the meantime, I will turn it back over to you, Wanda, to begin. We can start wrapping up the evening tonight.
Okay. So thank you, everybody, for being able to come to the My Mandel's Pharmacist virtual learning experience. I think this is a great platform for you to utilize while you're beginning, before, during your cycles. As we said, the every Monday night at 7 p.m. Facebook Live or My Mandel's Pharmacist, go on there to watch these wonderful videos with other healthcare professionals like myself, here live for any questions that you might have, and as well as the videos for you to be able to see, and know that they're always there as a backup for later after this evening for you to watch. And again, I think the more you see things, the more it sticks. And I think that is definitely the biggest part of that. And hopefully you feel a little bit more like an expert with your cycle when you are doing these medications and watching these videos. One thing I always do at the end of my videos, I am also a certified healing touch practitioner, and I'm always about the energy of ourselves, our energetic field, and our energy centers that we have in the body. So I always give a little tip. And something I got for Christmas was a great book here by Louise Hay on You Can Heal Your Life. She has over 30 years of experience with being a personal growth and self-healing inspirational teacher. And some of you may be aware with 2021, I think we want to start off on a good note. And you may already implement doing a daily affirmation. Daily affirmations are simple statements that just describe a goal in an already completed state. And as you bring more energy to any thought or any action, you increase your powers of creation. So what I looked up in her book, I went kind of fast forward ahead, and I'm thinking about what we do here with the fertility injections and what we're trying to do with pregnancy. And the sacral chakra, which is located between your belly button and your pubic bone. That's your energy center, the sacral chakra. And if you think about it, the ovaries and the uterus are there. And that is in Louise Hay's book, it's the area home of creativity. So what I wanted you to know, and I wrote down here just in my own handwriting so you could take a peek, is I wrote down 2 affirmations. And these are affirmations that you can put on any little pad of paper, a sticky note, put it on your computer, put it on your laptop, put it on your mirror, put it in your car. But one is, I love and approve of myself, which I think is a wonderful affirmation. And the other one is, I am at home in my body. And that is specific to the uterus. Where that uterus is the center of creativity. Think of the center of creation. So I am at home in my body is the one that's for that sacral chakra. And I love and approve of myself. And who can't use that? Because I think we all could use a little more self-love in some of these stressful times. And I think sometimes fertility is a little bit of a stressful moment. So want to do whatever we can to give you some positive influences and positive impacts there. So I hope you find doing the daily affirmation that I provided is a useful and a positive way, an empowering tool that you can utilize before you get started, during your cycle, or just at any old time. And you can say it daily, 100 times, 10 times, 1 time. And just, again, it's helping that energy and that good flow with this cycle and get off on a good foot when you get started.
Well, first off, I want to say thank you so much, Wanda, for all of your expertise and all of your knowledge and time that you brought to us tonight. Not only just about answering the questions, but at the end, sharing some of your personal outlook on how to help people get through a lot of these, what feel like at times can feel a little bit difficult and overwhelming. And with everything that's going on in the world right now, the last thing we need to do is add additional things that are going to make us feel overwhelmed, or like there's too much for us to handle. And just to know that you can handle this, and that's what we're here for, is for you to be able to walk through this process and feel comfortable and know that you have support in your corner, beyond just your clinic at home and your family and friends, but also us at Mandel's, Wanda, and all the information that she's able to share. So thank you so much to everyone who joined us via Zoom and Facebook Live for sharing all your excellent questions. We hope that you were able to learn something tonight. And really, there were a ton of great questions. And so we cannot thank you enough for being able to bring all of that excitement to ask to this program. That's what the program's all about. Don't forget that all these programs, both the full virtual learning experience videos, as well as we mentioned those smaller individual products, and even into some additional, like some behind the scenes stories of behind the shots on why our nurses got involved in this program and why they got involved in fertility in the first place. All that stuff is available for you. So you can find that on our Facebook page, our YouTube page, and you can find it at where Wanda, you already mentioned, but our mymandelspharmacy.com/pharmacist is a great place to go. Just bookmark that page and you'll have access to all those videos right when you need them. So even if you want to queue it up right before you're about to give the shot, that's a great place to go. So we want to say again, thank you everybody for coming. We look forward to seeing you here again next Monday night at 7 p.m. Eastern Standard Time for another great program. Thank you to everyone who came, with the Happy New Year, all of that just around the corner. We're now finally here. 2021 is here. So thank you for sharing the first Monday of the new year with us. We are really excited. And the one thing we want to say is, for every person that showed up, there's 100 people that don't know about this program yet that could probably learn something from it. So anybody that you know of, whether it's a family member, a friend, a colleague, just anybody that you think could benefit from this program, please share with them. Let them know about the Pharmacist program so they can also come and bring their questions. And sometimes just being able to have an ear to hear you and to know that you're being heard is what's going to help you get through this process. So thank you again, Wanda. Thanks you to everybody
Craig.
at home.
Appreciate
Absolutely.
you. Gratitude.
Thank you very much. Happy New Year, everybody.
All right.
Have a great
Happy
night.
New Year.
See you next time.